Hi, my name is Nancy Donahue, and I'm here to talk about telemedicine for elderly patients, barriers, enablers, and future promise. The big idea, according to the U.S. Census Bureau, 92% of households in 2018 had a computer, laptop, smartphone, 85% had broadband access, 84% of households owned a smartphone. The time is ripe for telemedicine. Elderly patients face the most barriers to care. They have chronic conditions, limited mobility, cognitive decline, and less familiarity with technology. COVID forced a rapid adoption of telemedicine for seniors. This was a huge learning experience. So my questions were, what are the facilitators and barriers to the adoption of telemedicine pre-COVID and post-COVID? What strategies, approaches can help promote the adoption of telemedicine among older adults? And how effective are telemedicine interventions for supporting chronic disease management among older adults? The results: video visits before COVID were rapidly increasing. 2010 to 2017, it was a rise from 35% to 76%. Claims for video visits increased 53% from 2016 to 2017 per the AMA. Barriers to adoption were increased regulatory laws, privacy, low reimbursement payments, and non-user-friendly software that was difficult to use. Video visits during COVID rapidly advanced just due to necessity. Waivers came out and increased the number of reimbursed physicians, increased the amount of reimbursement, and then the services that were reimbursed, and it waived penalties for using standard devices like smartphones or tablets. And you could even use Zoom and Microsoft Teams. The barriers and facilitators. The barriers, the video visits depend on the internet access and home devices. Poverty, language barriers, lower socioeconomic status, inadequate telemedicine infrastructure, and poor technical assistance hampered a lot of efforts. Facilitators, increased video visits and access to physicians and clinicians, increased physical and mental health just due to the increased visits, self-efficacy, being more involved in your care, reduced travel and waiting room time, decreased readmission of the patient to emergency facilities, reduced patient cost, and reduced provider cost. The providers can reach a larger amount of patients, and they don't have to open up new offices for that. The strategies for improvement: it needs to be a multi-pronged program for telemedicine to reach the elderly patients, a community-based marketing program for awareness, digital literacy education, technical assistance through the public library or community centers, community-based programs with staffed healthcare kiosks and digital device donation programs, and technical assistance via phone call. Chronic conditions that can be treated. Chronic conditions make up the majority of healthcare spending in the United States. Telemedicine for depression in homebound elderly patients increases the number of visits, which of course decreases the patient's anxiety. Telemedicine for musculoskeletal visits was as effective as in person for observational assessments like gait and swelling. Wasn't as good for more of a diagnosis visit where it needed to be more hands-on. Routine checks of blood sugar levels and maintenance for diabetic patients, it was a good fit. In conclusion, the potential of telemedicine to improve the frequency of care, reduce costs, treat chronic conditions, and reach the low-income elderly population is too significant to ignore. This requires a marketing awareness campaign, digital literacy education, clinicians need to be trained, patient technical support, clinician technical support, a website with online tutorials, and community-based resources like the public library and community healthcare kiosks. In my own experiences, I have a 91-year-old father with dementia who is a flight risk, who likes to take off, and an 87-year-old mother with diabetes and a history of 4 strokes who has mobility issues and is a huge fall risk. Anytime I can decrease them having to go outside of their assisted living facility for healthcare and have a video visit, it's a huge win on my part. and to increase their access to health care increases their health benefits for maintenance of diabetes and meeting with doctors, to discussing certain dementia, effects of dementia on the physical well-being of my father, and then discussing options with doctors via video visit has been instrumental in keeping them in better health. I'd like to thank you for listening to my presentation. I hope you enjoyed it. And here's a list of my references.